Hi, I'm Bill Doherty, and I want to welcome the viewers to another edition of Bill's Bullpen. Bill's Bullpen is a program that's intended to give folks an idea of what's going on locally, introducing them to topics that they may want to find out more about, and perhaps get a little bit more informed about what's going on in the area that we love and we live in. Today I have not only my good friend, but someone who I guess you were a direct report when I was a county commissioner.
I was.
And I want to start off by giving you kudos because I remember that when we started the Emergency Response Committee years ago, you were what I'd call the catalyst that brought the blue and the red together, and also were behind integrating what I'd call the public health sector into all of that, so that there was what I'd call a complete continuum of communication and also protection for the community. And that was all you, Sean.
Well, thank you, Bill. Thank you. It was a great team. We had a lot of good police chiefs and fire chiefs and health agents all working together to form this regional emergency planning committee. And, it allowed us to, really show, whether it be a storm event, whether it be, say a tornado, a winter storm, or even a pandemic, that here in Barnstable County, we work really well together.
Well, here we go. Now, that's a great segue into the pandemic. How long have you been working on this event?
We started out with really looking at things in late February, early March of 2020. Mm-hmm. We started to, hear what was going on in China. We started to hear about hospitalizations, a high illness rate, a high fatality rate. And then what we really started to realize was, in today's world, and this is, by the way, with a lot of guidance from CDC and Mass Department of Public Health, but in today's world, especially the way transportation works with planes, trains, whatever, a communicable disease can spread across the world pretty quickly. And we saw that. But we realized early on that we needed to start working together and start getting some things set up when it comes to combating this virus. Because it wasn't a matter of when or if it was going to hit our area, it was a matter of when. Mm-hmm. And so, very early on, we started working with Cape Cod Hospital or Cape Cod Healthcare, mm-hmm. Cape Cod Community College, the 15 health departments, and Hyannis Fire Department, and we developed a test site over at the community college. That was one of the first regional test sites operational.
When did you set that up?
That was about mid-March, second to third week of March.
Okay, so within 6 weeks of, let's say, being aware of it, you had something in place that we're looking at. 4 weeks, okay.
4 weeks, and it was an incredible partnership. Mm-hmm. And we ran that site doing testing right up until July of last year, mm-hmm. and then moved everything back out to additional locations. So we moved things back over to the hospital, to both hospitals when it came to testing. And we then started to use that time to really respond to questions from the public. We had staff that was doing contact tracing for some of the towns on the Cape. And then what we were also doing was looking at how we wanted to start to work on, vaccines, mm-hmm. and what we were going to do for vaccinations. And, we had a pretty good idea. We know that we knew it was going to be slow right at the beginning for having mm-hmm. availability of vaccine. It's just that's the nature of it. And when you're looking at a number of vaccines with emergency use provisions, mm-hmm. you just know that they have not developed as much. The stockpiles are not necessarily there yet. So it allowed us to look at what type of program or what type of vaccination program we wanted to do for the community here.
Remember years ago we had the issue of distributing those magic pills for radiation
Sure.
sickness, and one of the things for me, because I had worked in nuclear power plants, sure. is these things don't work. But there was a perception on the part of the people that if they had them, it would become invulnerable. Right. Now, because of that experience and because mm-hmm. of what I'd call the the lack of reliability and that level of protection. Did you run into that resistance or that kind of resistance when you were trying to get people on board for getting the vaccine?
Early on, no. I mean, because there just was not enough of a supply down here. You know, it's interesting. Those, we used to use the distribution of those potassium iodide pills as we used to use it as a way, as an exercise of distributing vaccines or prophylaxis if there was ever some type of problem. And we used to call these emergency dispensing sites. And every town on the Cape actually has an emergency dispensing site planned.
Really?
They do. And many of the towns were ready to use them. It was just something, it was a direction the state did not go in, though. And the state was looking more at big clinics and having these big clinics available to, to be there and to be able to handle, say 4, 5, 6, 1,000, 600 or 1,000 people a day coming through. And that's where Gillette really came in. You saw these very large mass vaccination clinics opening up. But we felt it was really important to have one here in Barnstable County as well, and to be able to have a few in Barnstable County. We're very spread out, and we wanted to have things regionally to be able to get vaccine out there.
And I have to say that you have agreement from me, because one of the issues is that arguably the age demographic on Barnstable County and Cape Cod is the oldest in Massachusetts.
And New England.
In New England, and although I won't say that, and I guess I can say this because I'm of that age, we're not God's waiting room exactly, but the idea of traveling unnecessarily is something that I would get concerned about.
Sure.
So having said that, the idea of having local availability to me is something that serves the needs of the people and where they're at right now. And one of the things that I noticed early on, you look at the numbers, and the numbers said that we were ahead, Barnstable County was ahead of the whole state in terms of the percentage of vaccine that was actually distributed. And I was very proud of you for that.
Well, thank you. And it's, and there's times where it's a little hard to believe that we've gotten to that level, because very early on, the amount of vaccine that we were receiving as a region was very small. So every week in the beginning of this, we saw just under 900 doses, just under 1,000 doses coming into Barnstable County. And so what we realized very early on was, in order to do all of this, we needed to make sure that there were partnerships with other organizations. And what really happened here, Bill, was we saw a great development of a consortium here in Barnstable County, which was made up of community health centers, Cape Cod Healthcare, Barnstable County, the 15 towns, and maybe not as much, but still having them there were the pharmacies that were here within the county as well. And not only that, there was also a group of people that were driving people up to Gillette, which were heroes all amongst themselves. So we realized that we needed to do a consortium approach to getting vaccine out there, and where all of us were able to do vaccinations and share them. And really, it's hard to believe that we were able to get to those numbers, because we only had 980 or 970 vaccinations a week available to us. And slowly, as the amount of vaccines started to come in to the region, we were able to expand, and we were able to do clinics in different locations across the Cape, whether it be at the National Seashore in Eastham, or at the Orleans DPW for a drive-through clinic through their DPW garage. The Melody Tent, we had vaccinations at. The fairgrounds, and we also had vaccine available at Cape Cod Community College, which ended up becoming our flagship location. And those were important things. But then also, we saw this real big effort with Cape Cod Healthcare where they said, we're going to be out there too. And they started getting out there and making vaccine available to right across the board to people across the Cape. Now, in the beginning, a lot of it was, for them, not that it was easy, but they were able to get, they had a good patient database that they were able to get a hold of and really look at the different age tiers that were required by the state. And then we were able to also set some clinics up. But I will say this, it was not easy in the early days because the software really didn't work.
Tell me a little bit more about the software, because I think people have what I'd call an inordinate amount of confidence in, let's say, in the ability of software to manage events.
We used a software called PrepMod, and technically it did what it needed to do.
Mm-hmm.
It set up appointments. The problem is when you have such a low amount of vaccine coming into the area
Mm-hmm.
and the limited number of appointments being able to be scheduled for
Mm-hmm.
people to get vaccine, it was like the Indianapolis 500 for people to schedule.
Tell me about it. I'll tell you my personal
Mm-hmm.
experience, which was I was lazy enough to wait for something to be available on Cape Cod.
Yeah.
So there was the announcement. Go online
Mm-hmm.
at 9 o'clock in the morning, and you'll be able to schedule yourself. By the time I got to my spot, because I started off at 9 o'clock,
Mm-hmm.
at 9:15 they were all gone. Now, I'm healthy enough.
Sure.
So instead of sulking, I went on the Gillette site, and they had one spot open at noontime. It was 9:30. I got off my rear, got in the car, and drove up there. Got the and went through the cycle up there. And I was very impressed with the Gillette operation. It's $1 million a day thing, and it looked it.
Absolutely.
Yeah.
Absolutely. And
And
they
it's something
were,
that I would be very concerned if we were rising to that level of expense, which brings up another issue I'd like you to talk about is who's paying for all of this?
well, a lot of the, vaccine, of course, is no cost.
Yes.
And one thing that the county commissioners did, and they were so proactive on this, was they looked at this event and they said, we need to look and we need to make sure that there is money available for us to be able to support these regional efforts. We took a hybrid approach, Bill, which is basically we had a big regional component which Barnstable County had, and then we had a smaller local component that every health agent had working with community health centers
Okay.
and hospitals to get people vaccinated. So the commissioners really looked at this and they said, we need to make sure that we have this strong component operational, and quite honestly, they set aside $1 million. And they set aside $1 million for us to go through and to be able to pay for contract nurses. We also had a mix of volunteers in there, and to set up these sites. But quite honestly, a lot of that, most of it, was also donations too, or vaccine. Vaccine was free, as was a lot of the supplies that go along with it, the syringes, etc. And locations were free. We weren't paying rent for anything. It was the goodness of Orleans DPW, the National Park Service, Cape Cod Community College, and the folks at the Melody Tent. They, here's a commercial entity letting us use their parking area. And the fairgrounds, of course, too, who was so good. That was all for free.
It gives me that wonderful feeling that Cape Cod is retaining that sense of we are a community,
We
and
are.
when somebody points the gun at us, we all gather together to work together. Even though there are issues, God knows when
There were.
in the times when I had been active in public service, I saw that there were differences. And as you get older, you recognize that these are all legitimate concerns that people have, and in order to get something done, you have to recognize where people's concerns are and try to get them to compromise. But on this, I'm very proud of the fact that we, as a community, got together and got it done.
And everybody did, and every town did. It was such a regional response, and especially when you look at our 15 boards of health and the fact that we've worked together since the department, for over, at least I've been with the county for 35 years. We've always had a great relationship with the towns, and we all work together and we've all planned together, and we're able to set up these things. And what it also shows is when the fact that we had all of this emergency planning that you began the show with, it all comes around to that, Bill. It comes around to the fact that we have a strong working relationship with health, fire, EMS, and law enforcement. And all of those entities were there and helping. You know, right now, if you drove down Main Street in Hyannis, there's a real good chance you're going to see a Hyannis Fire Department ambulance offering COVID shots to people in town. And out there trying to work to get people vaccinated. And that's really, you know, and that just right there is a testament of just the way we all work together down here. And I think what it also did was, and sometimes, you know, you don't see as much support from off-Cape entities when you do have such a strong relationship. It happened with testing. We were really in a difficult situation. We had really one test location, but we needed to have more testing available in Barnstable County, especially as we started to enter last fall and we entered into this second big increase in the number of cases, or the second mountain of cases, as I like to call it. We needed more testing. We were trying to get a Stop the Spread site here in Barnstable County, and we kept working with the state, etc. And we weren't able to. They did not provide it to us. So we just went and we did it ourselves. Now, granted, we used state money, but we used these partnerships with Cape Cod Healthcare, where they were able to open up a facility. You know, they were doing testing at Cape Cod Hospital. Cape Cod Hospital and Falmouth Hospital both offered testing. Outer Cape Health Services offered testing at their 3 locations on the Outer Cape. And then as a department, we offered it at the fairgrounds. And this allowed us to really expand testing across the region. And it's like when you're told no on something, it's really reassuring when you have a region that works well together that says, okay, we got to find another way of doing this. And that's what we did. And we got it out the door, and it worked out really well.
Now, I will say that as capable and as, let's say, as effective as you've been, the county employees, my experience was they all represent that kind of value in terms of service to the community. And you find out that within the towns, there are a lot of dedicated people, especially within the health service community, that you know, that have not been sitting on their hands. They're doing what they can to make things, let's say, better able to happen. I know that that one of the things that had occurred early on when I was a county commissioner was we discovered that there wasn't what I'd call effective interoperability in terms of communication network between Bourne, Sandwich, and Plymouth, and that needed to be addressed. And I remember we stepped up and bought the radios and gave them to Plymouth. And there was a certain amount of screaming about that, but my feeling at that point, and I think I got support from our health and human service people, that waiting for them to agree to do something that helps us is not going to get is not going to solve the problem. So the idea is, let's solve the problem and we'll figure it out afterwards.
Exactly.
Now, and having said that, there's something else that that has occurred. Plymouth County has been given some what I'd call criticism when they're not being able to support the federal grant money that has become available. And I'd like you to speak a little bit about, because that sort of restores, makes us whole, as a community. Actually in the paper today, Beth Albert was talking about hiring somebody to do the coordination. But even without that happening, what was the plan to, let's say, to manage that input of money to, let's say, to make us whole?
Sure. I mean, I think, always the county has looked at ways of making sure that things are managed properly. So I think what was really important was they put that in the paper, they advertised that position, and as we sit back and we look at the services that we're able to provide to the 15 communities, it's really important to have somebody that's going to be able to keep track of all that money and be able to provide us with a really strong, just a really strong accounting. Because with this type of money coming in, there's always going to be an audit, And you want to make sure you have a strong accounting of everything to make sure that it's all gone to the places that it needs to go. And I think the county, we've always had great vision there, Bill, as you know. We have a lot of great departments, a lot of great, department heads that are always looking at ways to expand services to the 15 towns. It's not we don't work in silos. We work as a team, and we always want to make sure that we're teamed up with the 15 communities, all of their departments, but also the other nonprofit agencies that are in the area as well, like APCC or Center for Coastal Studies or whoever else may be out there. And that's really where county government is so effective. It's a way of, and we found this out with REPC. It's a way of being able to provide regional programs that provide a lot of support to the towns and, that don't necessarily take over, but provide that level of support that a community needs.
The most important part of what you said is the fact that we're the county government and services, and this is something that was an article of faith with me, is not there to take over
That's
the
right.
program, but is to support the needs of the community through the towns. And I think that at least during the time that I was there, and I'm proud to say that from my less than casual observation of what's happened since then,
Yep.
that is something that's been carried through. Because the most important thing of all of this is that when we say we're from the government, we're here to help you, we better mean it.
Exactly. And that's the mantra that we've always had. I mean, at Barnstable County Health, we've always looked at things like, yeah, you've got a town health department to do the day-to-day. But if there's something you need support on, we're here to help. So, if you need help with septic plan review, we're able to do it. If you need help with restaurant inspections, we're there to do it. If you need help with responding to a pandemic, that's what we do.
Okay, now getting back to the pandemic, because this is, the meat of the program, is that, okay, you've talked about the mechanics of, let's say, delivering the services. You've talked, and this is very important for the community to hear, about how we've all worked together to get the job done. What are the lessons that you've learned that you would incorporate into a plan update?
I think, a lot of this pandemic, we had basic outlines of a plan at a community level. I think one thing that I think we need to do, because a lot of what we were doing was making it up as we went, in some cases, especially with the testing. We really need to sit down and do an after-action report after this event, and then look at what is needed. And look to get everything in a process down for setting up testing if that's ever something that's needed in the future. I think also, looking back on things, what's really important with any event is making sure that you have a strong handle on public information and making sure that you have ways of being able to provide information to the press and to other entities and making sure that you schedule it, because press inquiries can take over an event and make things very difficult
I
for responding.
have serious problems, over time about the difference between the headline writers at the Cape Cod Times and the content, because the content, and we've been very well served by the reporters that have
We've had
covered
great
us.
relationships.
So if you read the article, it's direct, clear, and honest. If you read the headline, what?
Yeah.
So I would encourage the viewers when they're reading articles about any kind of government, is you get beyond the headline, which is supposed to grab your attention, and get into the meat of the article to find out what's really going on.
Yeah, and I think, we really need to document how we established phone calls and press releases and everything else as a part of it. And that was really important for us.
Well, how would you suggest that we, let's say I don't think we have a reverse 411 or 911, do we?
The county, I think, may still have something through the sheriff's department, but quite honestly, every town has one.
Okay. So in terms of lessons learned, the after-action report, of course, is essential. But the next piece is we have an emergency response committee. I would suspect that would be sort of the basis of creating this, let's say, new response plan.
Right. We would work with the health agents and with the regional emergency planning committee, and we would look at ways to actually, get what we did, evaluate what worked, what didn't, and then get what works down in writing. And that's really what you look at doing. I think, the other thing too is when looking at these things, you also need to look and see what worked outside of the planning process. I think if we had to go with this again, we might use a different software. We might develop our own software next time. We were very close to doing it this time for appointments. But unfortunately, we had to have that link. And it's not unfortunate. It's just that it was easiest to have the link with the state. We had to have that link where we were able to share, to be able to get registrations in when people received a vaccine. And that was just, and that was so critical. But I think as we looked, we learned early on that there were certain things that didn't necessarily work in the software. I think the other thing that really worked out well too was information to the public, but not through means of the press. And one thing that we learned very early on, and this was actually an idea of one of our county commissioners, the development of a hotline, the development of a call hotline. And we actually had 40 Medical Reserve Corps volunteers that were answering phone calls. And that was so important. And I have to say, I know we've been talking for a while, between the volunteers that graciously donated all of their time in difficult situations. And I'll tell you, every one of our employees at Barnstable County I would work with again any day. And that's not
As would I.
It's with our department and every other department that worked on this. This was a whole county response, a whole Barnstable County government response. And every one of those people worked so hard on this. It really was incredible.
Well, it's obviously good news, and doesn't surprise me one bit, because we have been very fortunate here to get the kind of people to serve us. Now, we're getting to the end of this, so one of the things that that occurs to me, we have about 215,000 people that live here.
Maybe a little more now.
Oh, yeah, that's right. They're all coming in from New York
Yeah.
and other places in order to to reestablish themselves. Okay, but with that population and the fact that because there are a lot of, let's say, retirees and seniors, people who look like me with the piety, how many more people to have complete coverage of the vaccine? How many more are left to be done?
So we've actually looked at those numbers just recently. So we've had at least 70, and those numbers will change, but we've had at least 70% of the citizens here in Barnstable County have received at least one dose. And I think the number I remember seeing was 54% have received 2 doses. And we get weekly reports on that. We estimate when you take out the children under 11 from our total population, because they're not allowed to be vaccinated right yet, we're probably still looking at 50,000 people for 100% coverage.
Okay, well, 50,000 people out of 215,000, is a reasonable amount. So at this
almost
point,
60, yeah.
Give me your final takeaway on this.
Well, I think it's important, we're looking right now at 70 to 75% people getting vaccinated, Bill. We don't know what's going to happen. We have not received any word yet regarding booster shots or what's going to happen in the fall. And so within a couple of weeks, we're going to be planning, once we hear what's going on through Mass DPH. There's a light at the end of the tunnel here, but we're just not quite there yet.
Okay, not being quite there yet, I would say to the viewers, keep tuned and pay attention to the announcements that are coming out, because one of the things that Barnstable County does is we do communicate, we do talk to people, and we want to make sure that everybody knows what's going on. Yeah. So with that, Sean, it's been delightful to see you.
Thank you, Bill.
My best, Angela.
I will.
And I want to thank the viewers for spending some time to find out more about how we approached this particular problem, as we do many of the problems here in Cape Cod, which is working together to get the job done. So with that, I want to thank the viewers for watching, and you've been watching another edition of Bill's Bullpen, a product of Born TV.